Good morning. Here to present ESWL, Extracorporeal Shock Wave Lithotripsy, a no-touch technique of kidney stone removal in children. Here is a 3-year-old male child who has presented with right loin pain. On evaluation, found to have a 9 mm stone in the right renal pelvis. The stone was radiolucent, and here is the stone seen on ultrasound. Being a radiolucent stone, we were not able to localize that on a plain X-ray, but on IVP at 10 minutes you can see the stone is highlighted by the contrast of IVP. Here is how the patient is positioned. The patient is anesthetized, and this is the position of the patient. You can see the table is specifically designed for ESWL, which has got a rectangular defect to expose the lumbar region of the patient. This region would accommodate the head of the shock wave generator during the procedure. Here is down-ear sigma lithotripsy, a high-end machine for lithotripsy. You can see an ultrasound mounted on the top, and here is the head of the shock wave generator, which would be filling in this rectangular defect. Here is the final appearance before the procedure is begun. You can see an ultrasound probe here for precisely locating the stone. You can see the head of this shock wave generator coupled to that of the patient with acoustic coupling jelly. These two maneuvers is of paramount importance. By precisely locating the stone and by proper coupling, this would enhance the efficacy of ESWL by reducing the wastage of shock waves. In the ultrasound, you could also see a post-acoustic shadow before the procedure is begun, though the calculi is not clearly visible in this zoomed out view. You control the entire process of ESWL, and this control has got 4 display slots. The first one shows the number of shock wave delivered, the second one shows the frequency, the third one shows the energy, and the fourth one shows the size of inflation of the shock wave generator head. If you could actually look at it, we have delivered 269 waves so far with a frequency of 60 per minute, with a medium energy, and the shock wave head being completely inflated. Here you can look at the calculi, and this is how the shock wave is being delivered to the stone. I hope you appreciate the shock wave. The biggest advantage of the ultrasound guided ESWL is you can keep an eye on the stone till the entire procedure is done. At the end, we could manage to deliver 1600 shock waves to get rid of the calculi, and no calculi was noted at the end of the procedure on screening. The catheter was removed after 24 hours and the child was discharged the next day. 14 days later, an ultrasound showed no evidence of calculi. And thank you for watching.